The charity fund in the sphere of support of social and cultural initiatives of Lieila Adamyan presents Scientific and Practical Conference Infertility in Marriage – Methods of Fertility Restoration. Now, in vitro fertilization has been practiced in the Russian Federation for over 30 years. We know that today in vitro fertilization is the method of treatment of female and male infertility, which enabled Russia to have almost 1% of all births after in vitro fertilization. In the past, IVF was primarily intended and applied for the cases of tubal-peritoneal infertility, as we have heard in the previous presentation. And later, the indications were greatly expanded. They are endometriosis, inflammatory diseases, combined infertility, and a lot of other factors. As of today, within the framework of the mandatory medical insurance, many of our women, our infertile couples, have been able to add to the number of children in the Russian Federation, thanks to this modern method of infertility treatment. The next presentation is devoted to in vitro fertilization as a whole, taking into account different factors, and I'm gladly providing the floor to Lyubov Vinogradova. She is a doctor of reproduction, candidate of medical sciences, and her presentation is titled In Vitro Fertilization and Other Methods of Assisted Reproductive Technologies, Advantages and Various Risks. The floor is yours. Good morning, dear colleagues, dear Ms. Adamyan, and dear panel members. Let me start with the general concepts that describe IVF. IVF means fertilization outside the body or in vitro fertilization. As for the history of development of this process, it started back in 1968 when embryologist Robert Edwards and gynecologist Patrick Shreptow began collaborating on obtaining oocytes with subsequent insemination, and the first extrauterine pregnancy was achieved only in 1975. And the first child after the IVF was born in 1978. It was a girl, whose name is Louisa Brown. I'd like to draw your attention to the fact that the successful attempt was number 103. It resulted in pregnancy. For the married couple, the Browns, it was IVF attempt number 10. Perhaps any other scientist would give up after 100 attempts. However, Edwards continued working on it. As for our country, at the origin of IVF, it was Ms. Adamyan. In 1978, she and Dr. Boris Leonov worked on obtaining oocytes using a laparoscopic access. After the material was obtained, it was transferred to the embryological laboratory for fertilization. The success was achieved in 1986 in the Scientific Center of Obstetrics and Gynecology. The first baby was born through the IVF in Russia, and her name was Lina. In the same year, in St. Petersburg, a boy was born named Kirill at the Institute of Otto. And only in 2010, Edwards was awarded the Nobel Prize for Scientific Achievements. By the way, I'd like to mention that this is the only area that was nominated twice for the award. Today, it is a social project. We provide the program of assisted reproduction for couples in the framework of the mandatory medical insurance. So, what is assisted reproduction? It is a method of infertility treatment under which some or all stages of conception and early embryo development are implemented outside the body. Today, it is the most effective method, which provides a unique opportunity for getting pregnant. As of today, more than 7 million people on Earth were born with the help of assisted reproductive technologies. What do these methods include? In the first place, I'd like to focus on artificial insemination with the sperm of the spouse or a donor. The reproduction doctor conducts an examination of a married couple and monitors the follicles of the woman. If the dominant follicle is not growing, then they use the minimal stimulation scheme. In most cases, is done with tablets. When the dominant follicle reaches the required size, the woman is injected a chorionic gonadotropin for ovulation induction. After 36 hours, the woman is invited to the insemination procedure. The specialists use a long catheter, which is inserted into the uterine cavity, and pre-processed sperm is injected into the cavity. The sperm is injected with the greatest concentration. In other words, the embryologist processes the sperm in advance and creates the highest concentration of the sperm. I'd like to note that the success largely depends on the sperm concentration, because the higher their number, the greater the chances are for success in achieving the pregnancy. When is it necessary to do an artificial insemination? The main and only important criteria is the patency of fallopian tubes. If the fallopian tubes are blocked, it will not be possible to achieve pregnancy through insemination. There might be a slight impairment of spermatogenesis, a slight deterioration of the spermatozoid activity and mobility. There may be an ovulatory dysfunction, but the main factor is the patency of the fallopian tubes. In cases of their absence, we use the program of in vitro fertilization. What is it? In the first place, it is a stimulation of the ovarian function. The patient is prescribed gonadotropin in injectable forms. Then the ovaries are stimulated for greater growth of the number of follicles. When these follicles reach the required size, specialists also inject chorionic gonadotropin for ovulation induction, and the woman is invited to the procedure of transvaginal puncture. During the transvaginal puncture, we puncture all the follicles and obtain the oocytes from each follicle, and we transfer the material to a biological laboratory for subsequent fertilization. We do the cultivation in the biological laboratory for 3 to 5 days and subsequently transfer the embryos into the uterine cavity of the woman. As for the fertilization methods, today, in case of spermatogenesis disorders, decrease of the fertility quality of the husband's sperm, the ISCI methods are used, which is a microinjection of spermatozoids into the cytoplasm of the oocyte. In fact, it is the artificial insemination. The embryologist picks the best spermatozoids and does a microinjection into the cytoplasm of the egg, as it is shown in the picture. In what cases do we use this method? Above all, we use it in the case of a serious disorder of spermatogenesis, such as reduced activity and mobility, and of course, there is a great share of morphologically changed spermatozoids. The morphology stipulates the genetic potential carried by the spermatozoid. If the share of morphologically abnormal spermatozoids is very high, it means that the DNA quality in the sperm is poor, and the chances for obtaining a healthy embryo are low. Also, the ICI method is used and there is a small number of oocytes due to a variety of reasons. This may also happen, but we must create the best possible conditions for obtaining an adequate number of embryos. Therefore, we also use this method, and if fertilization rate was low in the previous IVF program. What else is included in the assisted reproduction methods? It is a possibility of using frozen oocytes. It is a program for preserving fertility in cancerous patients and a possibility of transfer of thawed embryos into the uterine cavity. When is the IVF program prescribed? It was already mentioned. According to the World Health Organization, the optimal age for childbirth is 17 to 26. It is the best age of a woman, which enables her to give birth to a healthy child. I'd like to remind you that the success of the program directly depends on the age. After 35 years old, the pregnancy rate in the IVF programs is reduced by 4% in each year. Age is a very important factor, which affects the woman's ability to conceive a child. I'd also like to note that the infertility treatment and examination must not last for more than 2 years. We often see patients who come to the doctors and tell their story, saying that during 5 to 10 years, and sometimes even 15 years, they were examined, treated, doing some hormonal corrections, sometimes a surgical treatment, but it was all in vain, and they did not get pregnant. And unfortunately, after so many years, the prospects that we have are not so bright. So please don't forget that the treatment and examination must not last for too long in case of infertility. Who needs to do an IVF program? The percentile is on average equal for all the cohorts. Around 30% it is women with infertility. The same percentage is male infertility. 30% is combined in cases of both male and female infertility, and the infertility of so-called unclear genesis is in 10% of cases. The indications for this procedure were discussed earlier. I will briefly repeat that the IVF program is indicated for women with absolute tubal or tubal-peritoneal infertility, when this path for the sperm and the subsequent return of the embryo to the uterine cavity is blocked. In other words, the fallopian tubes are impassable for some reason, or the fallopian tubes are absent. Then there is no possibility for getting pregnant independently. Also, these factors may include endometriosis, endocrine factors, adhesion processes in the small pelvis. In men, it may be a serious disorder in the spermatogenesis, when the spermatozoid is not able to reach and fertilize an oocyte. It just can't do it. We have some restrictions for carrying out the program. And the first and foremost that I want to focus on is the reduction of the ovarian reserve, when the number of follicles in the ovary is too small. And with the big doses of gonadotropin stimulation, it is very hard to obtain the woman's own biological material. What are we afraid of when undertaking an IVF program? The first thing that I want to mention is the syndrome of ovarian hyperstimulation. It is a serious complication which, thank God, today is happening in a small percentage of cases, only 2 to 4%. We already know how to cope with that. Nonetheless, it is a situation which occurs due to an excessive growth of follicles in the ovaries, and unfortunately it may lead to a serious complication in the health of a woman, and it may require specialized treatment in hospital and sometimes even in the intensive care unit. A great risk for a reproduction doctor and obstetrician gynecologist is multiple pregnancy. The IVF pregnancy is a high-risk pregnancy, and with regard to a multiple pregnancy, it is even a greater risk, both for the mother and for the doctor. Among the risks associated with the IVF procedure, there is a risk which is typical for any surgical procedure too. They are the risks of bleeding when we perform transvaginal puncture. Allow me to focus separately on multiple pregnancies. Of course, parents dream about 2 beautiful, healthy babies, but sometimes the results of multiple pregnancies are not so wonderful. In such a pregnancy, there is an extremely high risk of premature delivery. These children have to be transferred to the intensive care unit then. So you must remember that the pregnancy after IVF is a very high-risk pregnancy, and it must be controlled in specialized hospitals. As for multiple pregnancy today, abroad in our country, the leading IVF clinics actively promote the segmented transfer of the embryo, or transfer of one embryo into the uterine cavity to minimize such risks. People often wonder what kind of children are born after IVF and if they are any different from the children conceived independently. So, I'd like to say that children are not different at all. The main complications that children may have in their health are associated with the health of their parents, because the patients come to the doctor with a certain anamnesis, having certain aggravating circumstances, which may definitely affect the health of their children. Most researchers, both abroad and in our country, have not detected any differences in the parameters of physical development of such children. What are the advantages of the assisted reproduction methods? These methods provide information about the embryo by means of genetic diagnosis. They provide the possibility for genetic diagnosis of the diseases and birth of a healthy child. What are the main indications for the genetic analysis of the embryo? In the first place, it is the age of the woman. After 30 years old, it is a late reproductive age. It is multiple unsuccessful IVF attempts in the anamnesis when she does 3, 5, or 7 attempts with no good results. It is a habitual miscarriage of pregnancy when a pregnancy happens independently but becomes interrupted at early stages, and some severe forms of male infertility because the DNA that is carried by the spermatozoid plays one of the key roles in the embryo formation. Allow me to focus on the frequency rate of pregnancies in this category of patients. Without conducting genetic diagnosis, the pregnancy rate is less than 12%. With the genetic diagnostics of the embryo, the pregnancy rate is more than 52% in these patients. So the success rate is quite high. The pre-implantation genetic diagnostics has a very long history. In the past, Edwards attempted to segment chromosomes. And later, for a very long time, we used a method called FISH, or fluorescent hybridization, which allowed us to visualize the X and Y chromosomes and sex-linked diseases. But today, the science has advanced, and we have one of the best methods, which is a method of comparative genomic hybridization, which makes it possible to see the whole DNA molecule and diagnose the chromosomal diseases along the whole length of the DNA model. What other advantages are provided by the assisted reproduction methods? It's a possibility of a delayed motherhood. For some reason, sometimes we cannot do a transfer in the current cycle, and for this reason we can freeze the biological material and postpone the pregnancy. It is also very important for patients who are currently not planning a pregnancy and want to have their cells or embryos frozen at a young age and then use them in the future. What is this opportunity provided by? Methods of freezing. Currently, there are two methods of freezing. Slow freezing, which was used until 2010, but the effectiveness of the programs was significantly lower than the effectiveness of the transfer in the current cycle. Because during the slow freezing, it affected the embryo, and the defects in its formation when it was defrosted were very well visible. Today, all leading assisted reproduction clinics use the method of vitrification, or the transition of liquid into a glassy state without the formation of crystalloids, and the cooling speed is 42 degrees per second. The material is stored at the temperature of minus 196 degrees. It is almost an instant freezing, which does not affect the embryo. And today, the pregnancy rate in the cycles of cryotransfers and in the current cycles are the same. And in some categories of patients, it is even better in the cycle of cryotransfers. This is the reason why cryoconservation enables us to use the unused embryos. In other words, we do the stimulation, transfer the embryo to the woman, and 3, 4, or 5 top embryos are left for freezing. The woman gets pregnant, and 2 or 3 years later, she may come back for a transfer according to the cryo protocol and have more children. It is possible to store the biological material both for women and men, including cancer patients. Allow me to touch upon the use of the assisted reproduction methods in oncological cases. Unfortunately, oncological diseases occur at a young age in people who have not yet have their own children. And this method makes it possible to freeze oocytes, embryos, and the ovarian tissue before the anti-cancer therapy. After the recovery, the woman can use her own biological material for realization of her reproductive functions. As for the cryopreservation of the ovarian tissue, it is a relatively new method. It is used when we cannot do the stimulation to obtain the cells, if due to some reasons it is necessary to start an anti-cancer treatment urgently, for example, and in this case we do a laparoscopic surgery, resect the ovary and cryoconserve it, and after the recovery, the woman comes back for autotransplantation. In conclusion, I'd like to say that today, around 15% of married couples suffer from infertility. It is the data of the World Health Organization. The possibilities provided by the assisted reproduction methods are very wide, but they must be used correctly, relevantly, and timely. There must be indications for any manipulation when other methods are not working, and the assisted reproduction can help us to achieve the desired result. There mustn't be any counterindications against any manipulation. Today we have a clear instruction which regulates the examination of a woman before starting the assisted fertilization program. It is a very important stage, because during this stage we can sometimes identify a number of circumstances which are counterindications against the program, and a woman may require an urgent treatment. The assisted fertilization program must be implemented in a specialized medical institution having advanced technologies and trained staff, because it is a highly technological assistance which must be provided only by the leading medical institutions. Allow me to go back to the beginning and say that the age is a fundamental factor which significantly reduces the chances of getting pregnant. And remember that you should do everything on time. If it was too early for you yesterday, tomorrow it may be too late. Thank you very much. Thank you for the wonderful presentation. See you at the next conferences of the Open University of Lieila Adamyan.